Thank you, Mr. Chairman. Yes, we are here today to consider three different measures. Americans know all too well the devastating impact fentanyl has had on communities and families across the country. And we would welcome the opportunity to discuss real evidence-based solutions to this real-time tragedy impacting all of us. But H.R. 467, the HALT Fentanyl Act, does not provide that opportunity to comprehensively address this public health crisis. Instead, the bill doubles down on the well-established failures of the war on drugs with an incarceration-first approach to a public health crisis. We know that mandatory minimums don't work. When Congress imposed mandatory minimums in response to drug abuse in the 90s, we saw prison populations soar and communities devastated without appreciable impact on the availability or use of these illicit drugs. Over the past decade, we saw policymakers from across the political spectrum, from the Koch brothers to the Obama administration, come to the realization that these kinds of mandatory minimums do more harm than good. And we saw efforts to roll back those mandatory minimums, reduce incarceration, and repair some of the harm that had been inflicted with laws such as the First Step Act, gathering bipartisan support. But the bill we see today resorts to the same failed playbook of mandatory minimums, tying the hands of judges and exacerbating racial disparities in our criminal justice system. In addition to the bipartisan proposals of our colleagues, there are bipartisan solutions available. They are out there. There's a bipartisan opioid task force. And in addition to those bipartisan proposals, the Biden administration has also proposed comprehensive fentanyl legislation to permanently schedule fentanyl-related substances without pulling from the failed war on drugs of the past. Unlike the Biden administration's proposal, H.R. 467 takes a never-before-employed approach to scheduling fentanyl that limits the ability to remove or reschedule fentanyl-like substances if scientists find that the drug has medicinal or therapeutic value in specific cases. We can all agree that Congress needs to act to keep fentanyl off our streets. But a successful plan has to tackle the root causes of substance abuse. We can't incarcerate our way out of this crisis. It's a public health problem, and we have to approach it as such. So there are bipartisan solutions on the table, although not being brought to the floor. Unfortunately, the extremists controlling the House agenda these days aren't willing to work collaboratively to address the underlying social and health factors that cause our nation's substance abuse crisis. One of these bills is the Stop Fentanyl Overdoses Act, which, as I mentioned, has been put together by the bipartisan Opioid and Addiction Task Force. This act, among other things, expands access to overdose reversal medications, establishes a program to offer medication treatment for opioid use disorder to individuals who are incarcerated. It expands testing for fentanyl and related substances, increases information shared by public health departments and law enforcement, and streamlines the regulatory structure. Congress has voted 8 times now to extend the temporary class-wide FRS scheduling that is at issue in the bill before us today since it was implemented by the Trump administration. Yet the latest data from the Centers for Disease Control and Prevention shows an estimated 107,477 overdose deaths between August 2021 and August 2022. We need to do more than simply schedule FRS and incarcerate people if we're truly going to tackle this issue. In addition, the debt limit plan that the House majority pushed through a couple weeks ago cuts Customs and Border Protection funding, handicapping that department's efforts to seize fentanyl as it crosses our borders. The prediction is it will allow an additional 350,000 grams of fentanyl across the border due to decreased enforcement. Just 1 week ago, the House majority passed policies that make it easier for smugglers to bring fentanyl into the country. Now they bring up a talking point bill so they can say they're trying to stop the crisis. But that's the pattern emerging here. House majority complains about a problem, passes a bill that makes the problem worse, then tries to cover it up by passing another bill with a flashy title that does nothing to fix the underlying problem. We're ready with real solutions, but we need the Republican majority to come to the table to solve this and so many other crises. So in addition to HR 467, we're considering 2 Congressional Review Act disapproval resolutions. HJ Res 45 would reverse the Biden administration's action to ease federal student debt. In Pennsylvania, student debt has reached epic proportions in terms of a crisis. We have more people with more debt than almost every other state in the country. Ending the payment pause would be disastrous for student borrowers. If successful, tens of millions of Americans will be pushed abruptly into unplanned repayment, adding thousands of dollars in payments and interest back on their loans. There would be a wave of defaults that would only exacerbate our current student debt crisis. This resolution would create more chaos and confusion as the courts are working to make a ruling on this process. So Congress still needs to take substantive action to support borrowers and make college more affordable. This bill doesn't do that. Since Congress didn't act, the president did, and now this extremist majority is trying to claw back the support that has been provided for student borrowers. It's not the right way to go about this, and it is not helpful. It does nothing to solve the underlying issues. Finally, SJ Res 11 would reverse a well-researched and vetted rule encouraging decreased emissions in the trucking industry. Why is Congress once again using CRAs to make it easier for polluters to pollute? Especially when we know these kinds of truck emissions have a direct negative impact on respiratory health. In my district, 1 in 4 kids suffers from childhood asthma. We've seen data with respect to this regulation indicating that if you live within 200 yards of a highway that has heavy truck traffic, it's going to impact your health. I-95 runs right through my district. We have houses that aren't 200 yards from one of these, from the highway. They're about 50 feet. So it has a real direct negative impact. And once again, using a CRA to rescind a rule without having any policy or process to replace it simply is irresponsible. So we see the House majority pushing half-truths and messaging bills rather than coming to the table to actually provide solutions to the problems that face our American communities. They would rather undermine, repeal, and roll back democratic policies than offer substantive alternatives. It's a squandered opportunity, it's irresponsible, and it doesn't serve the American people. I look forward to hearing from our witnesses, and with that, Mr. Chairman, I yield back.
Thank you. I'll just note for the record, the Republican majority has not introduced legislation that would cut funding at the border. Quite the opposite. The Appropriations Committee is currently considering a Republican proposal to substantially increase money for border security. Without objection, any prepared statements that our witnesses may